Let us start with the first talk. For our first presenter is Dr. Soumya. She finished her oculoplasty training from Agarwal Eye Hospital, Chennai. Now she is working as an oculoplasty consultant at Chandraga Netralaya and Puttalat Eye Hospital. Welcome, Soumya.
Thank you. Welcome all. Good morning. I'm going to talk about facial dyskinesias, the abnormal facial movements. What are the types? How can we identify them? And what are the muscles involved? So these are the types: orbicularis myokymia, dystonia, which include blepharospasm, oromandibular spasm, Meek syndrome, hemifacial spasm, apraxia of lid opening, and rare things like aberrant regeneration of the facial nerve, psychogenic facial movement disorders, facial tics. So, little more about dystonia. Dystonias are sustained or intermittent muscle contractions causing abnormal, often repetitive movements, postures, or both. The 2013 update classified dystonia into isolated and combined depending on the etiology. In isolated, there won't be any neurological or systemic signs. In combined, there will be any systemic or neurological abnormality. Also, depending on the part involved, it can be divided into focal dystonia or segmental dystonia. Focal, when there is only one part of the body is affected, like blepharospasm or oromandibular dystonia, and segmental when there is two or more body parts, continuous body part affected, like Meek syndrome. So the other types are aberrant regeneration of facial nerve. This is because of misdirection of the regenerating nerve, which are supposed to supply the orbicularis, supply the other parts of the face. So there will be voluntary during the voluntary eye closure, there will be involuntary lip movements. There will be sometimes decreased lid height due to orbicularis contraction. Psychogenic facial movement disorders are very rare, which are unwanted movements of the body parts due to underlying psychological disorder. Facial tics are complex, coordinated, multifocal movement patterns and switches between right and left side of the face. Example is the Tourette syndrome. So this is a little bit about the facial anatomy. These are the important facial muscles. The first one is the frontalis one, which pulls the eyebrow up, and corrugator superciliaris and procerus, which pulls the eyebrow medially and downwards. Orbicularis oculi will help in eye closure. Levator labii superioris and zygomaticus major, minor, everything helps in upward movement of the lip. Orbicularis oris help in mouth closure. Rhizoris help in lateral movement of the angle of the mouth. Depressor anguli oris and depressor labii inferioris helps in the downward movement of the lip. Platysma helps in the downward movement of the mandible. So the orbicularis has three parts: pretarsal part, which is just above the tarsus; preseptal part, anterior to the septum. These two help in the reflex contraction of the reflex closure of the eye, and orbital part help in the voluntary forceful closure of the eye. So just move on to the different types of spasms.
You can see spontaneous, gentle
Sound.
You can see spontaneous, gentle, constant, rippling contractions of the lower lid orbicularis oculi muscle here. It lasts for few hours to few weeks. So the muscle involved in this condition is orbicularis oculi muscle, and the condition is called orbicularis myokymia. It is mainly due to stress, fatigue, caffeine and drugs like topiramate, clozapine use. The key to the treatment is adequate rest, reassurance and avoiding the offensive substances. If it is persistent more than 3 months, it's called persistent myokymia, and botulinum toxin injections can be tried at this time. In this patient, you can see bilateral synchronous spasms of the muscles around the eye producing exaggerated blinking. So in this patient, the muscles involved here are orbicularis oculi, procerus and corrugator superciliaris. Unlike hemifacial spasm, blepharospasm abates during sleep and decreases with activity. The eyebrows are pulled down here, known as the charcot sign. The causative mechanism is explained by Anderson as a three-component loop. External stimuli forming the afferent limb, a central control, and the muscles forming the efferent limb. When the self-limiting loop is disturbed, it produces blepharospasm. The treatments are botulinum toxin injection, medication, and myectomy. This patient has mild blepharospasm, but after installation of topical anesthesia, she looks better. So this is a case of secondary blepharospasm due to ocular surface disorders. We can see the spasms of this patient is mainly involving the lower part of the face, which is known as the oromandibular dystonia. He also has blepharospasm, cervical spasm. So this is a case of Meek syndrome. This patient has involuntary clonic muscle contractions of the one half of the face. Also notice the eyebrow of the ipsilateral side is little high. That is known as the Babinski-II sign. So this is a case of hemifacial spasm, which is caused by compression of the facial nerve leading to demyelination and aberrant signal conduction. It can be also due to intracranial mass lesions, so MRI and MRA of the head and neck should be done. There can be sometimes bilateral hemifacial spasm, which will be asynchronous in both sides. Also, Babinski-II sign will be positive. The treatments are botulinum toxin, oral medications, orbicular myectomy, and surgical decompression of the facial nerve. This patient is not able to open his lids following eye closure, and we can also notice frontalis muscle contraction there. But once he opens it with hand, the eye closure and opening is normal. So this is a case of apraxia of lid opening. There is involuntary inhibition of the levator function, prolonged contracture of the orbicularis, or both. It is usually associated with blepharospasm, Parkinsonism, drugs, and CNS lesions. So CT or MRI is mandatory. The treatments include botulinum toxin and myectomy.
So to conclude, to diagnose the spasms, we can divide the face into 4 quadrants with vertical and horizontal midlines. So if it is involving only the one upper part of the one quadrant, it will be orbicularis myokymia. And if it's involving 2 quadrants of the same side, it will be hemifacial spasm. In that, you can notice the eyebrows will be in the little higher position, known as the Babinski-II sign. So if the 2 quadrants of the upper part of the face is involved, it will be blepharospasm. In that, the eyebrows will be pulled down because of the orbicularis contracture. And if the whole face is involved, it can be either Meek syndrome or bilateral hemifacial spasm. In Meek syndrome, there will be oromandibular dystonia, blepharospasm, and cervical spasms. And bilateral hemifacial spasm, both sides of the face will be asynchronous, and there will be ipsilateral elevation of the eyebrow. Thank you.
Thank you, Dr. Soumya, for that wonderful presentation. It was all well covered, all the facial, with almost wonderful, all the videos.